Interview and physical examination secret number 7 is order appropriate diagnostic studies. And these physical examination secrets, actually the next 3 physical examination secrets, all have to do with diagnostic studies. Secret number 7 is order appropriate diagnostic studies. Secret number 8 is to enlist the radiologist. Secret number 8 is to analyze for loss of motion segment integrity. And we're going to spend some time on this section, especially with regards to an analysis of motion segment integrity. And I'm going to go through step-by-step procedure for performing the analysis of motion segment integrity and also for recording your findings. Let's begin with secret number 7, which is order appropriate diagnostic studies. So the question is, what diagnostic studies are required by the AMA guides? And let me just ask you, what studies have you heard referred to or have you seen mention of in the AMA guides? Well, let me give you some references from some of the specific chapters. In Chapter 15, the Spine chapter, it discusses some of the following diagnostic studies. It talks about plain film X-ray studies, talks about CT studies, talks about MRI studies, both with and without contrast, talks about electromyography or EMG testing, also talks about cystometry testing for assessing the bladder. What about Chapter 16? Chapter 16, the upper extremity chapter, talks about some of the following studies. Talks about X-ray studies, talks about EMG and CV studies, that's nerve conduction velocity testing studies, talks about MRI studies, talks about bone scan, talks about laser Doppler studies for assessing vascular integrity, talks about arthrogram studies. So quite a few diagnostic studies described in the AMA guides. What about Chapter 17, the lower extremities? Chapter 17 makes specific reference to X-ray studies, refers to EMG and CV studies, talks about Doppler studies for assessing vascular integrity, talks about MRI and CT scans, and also talks about bone scan studies. So let's talk about some of the uses of X-ray, and let's limit our focus for now to X-ray. Of course, the topic of diagnostic studies itself is a huge topic, specifically if we were to consider all the various modalities of diagnostic studies that we just discussed. But let's just talk about some of the uses of X-ray in the evaluation of permanent impairment as those X-ray studies are described in the AMA guides. And remember, the overriding philosophy of this particular physical examination secret is to order the appropriate diagnostic studies. And the guides require plain film X-rays in the determination of several different types of permanent impairments. So let's go over just a few of those now, so you will be refamiliarized with the importance, at least, of plain film X-rays in the evaluation of permanent impairment. In Chapter 15, the Spine chapter, X-rays are used for several different things. Number one, they're used to help identify pre-existing conditions or spinal anomalies, for example. They're used for the assessment of the acute or late effect of fractures. They're used for an analysis or for a determination of the loss of motion segment integrity. And we'll go over a practical method to perform an analysis of motion segment integrity here in this program in just a few moments. In Chapter 16, the upper extremity chapter, X-rays are used for a determination of permanent impairment due to ankylosis. X-rays are used to determine trophic changes of bone, and you can find specific reference to that on pages 495 and 496. X-rays are used for an evaluation of carpal instability. That would be permanent impairment due to other disorders described in Chapter 16. So let me ask you, have you ordered X-ray studies for the evaluation of carpal instability? The AMA guides specifically describe a method for determining the presence or absence of carpal instability on X-ray, and it requires specific views. And the purpose of this chapter is of this particular secret is to encourage you to become familiar with the specific X-rays required for an analysis of carpal instability. And those are listed in Chapter 16. With regards to the lower extremity impairments in Chapter 17, X-rays are used for measurements related to arthritis. For arthritis, we use X-rays to measure the cartilage interval, or more specifically, we measure for loss of the cartilage interval. And that requires specific X-ray views to be taken on each of the lower extremity articulations. We also use X-ray for an evaluation of limb length discrepancy. We use X-rays to confirm impairments due to gait disturbance. And this is an interesting point because some of the gait disturbance impairments described in Chapter 17 require an objective finding that can only be found on the X-ray. Chapter 17 describes the use of X-rays for determination of joint ankylosis, requires the use of X-ray for description or determination of fractures, and even for permanent impairments related to neurologic conditions such as causalgia and chronic regional pain syndrome. Those are some of the descriptions in Chapters 15, 16, and 17 that describe the use of the specific use of X-rays. Other imaging and electrodiagnostic testing modalities are described in each of the chapters. And in addition to those specific references in the guides, I'm sure you can imagine that diagnostic studies would have other uses as well. Specifically, you may rely on diagnostic study findings to support your conclusions related to causation, industrial causation for the injury in the first place, or perhaps you might rely on your findings on diagnostic studies to help support your conclusions on apportionment. In fact, that was the whole basis of the Escobedo case, was diagnostic study findings of advanced degenerative change of the knee that supported the conclusion for apportionment of permanent impairment of the compensable consequence right knee injury following a specific injury to the left knee. So that's a classic example, a famous example of how diagnostic studies were critical in the apportionment determination. So the point of this discussion is to make sure to order the appropriate diagnostic studies. And when you order those diagnostic studies, make sure that they're done perfectly every time. Make sure that the views of x-rays that you're getting or the type of MRI that you're ordering is exactly what is required for the determination that you're after. For example, as I mentioned earlier, the analysis of carpal instability requires very specific X-ray views of the wrist to be obtained, and those are described in the guides. Well, many times imaging facilities are not familiar with these specific views. Imaging facilities, many times these technicians, of course, they're not familiar with the AMA guides, so they rely on you to produce the images that you need, and so your instruction to them needs to be very specific, and you need to communicate with them prior to the injured worker showing up for the studies, so that the technician is on the same page with you and the technician is producing images that are appropriate. And remember that in the end, you doctor, you are the one that's responsible for making sure that the diagnostic studies that you are given, number one, are of sufficient diagnostic quality to be considered diagnostic, and number two, that they contain the views that you rely upon, or that the AMA guides require that you rely upon in the formulation of your conclusions. So, secret number 7 is to order the appropriate diagnostic studies for every case, and never render any conclusions without supportive diagnostic studies, or without diagnostic studies upon which you can rely in support of your conclusions. Number 8, also related to diagnostic studies, secret number 8 is consult with the radiologists. When you order diagnostic studies, as I said, many times these imaging facilities are not familiar with specific views. For example, I've found that many imaging facilities are not familiar with flexion and extension views of the spine. Many imaging facilities are not familiar with measuring cartilage intervals of the hip. And some of these descriptions that are in the AMA guides are specific to the AMA guides. They're not common to general radiologic practice, and so don't be surprised if the imaging facility does not produce exactly what you need. You need to work with them, and you need to train them, and you need to communicate with them so that you are getting exactly what you need. And this includes not only the technicians that produce your images for you, it also includes working with and training the medical radiologist that produces the report upon which you are going to rely for the formulation of your opinions. So, for example, you may find that the medical radiologist produces a report that includes his review of the images based upon what he considers to be important. Well, what the medical radiologist considers to be important may not coincide with descriptions from the AMA guides. And that's the purpose for this secret. Consult with the radiologist. These radiologists are more than willing to speak with you on the phone. They're more than willing to review images with you over the phone. You can both bring up the images on your computers and go over those images one by one and arrive at a common conclusion regarding the findings. For example, many times I notice that medical radiologists do not ascribe much significance to spinal anomalies. and you may ascribe a different importance to spinal anomalies. And perhaps if the medical radiologist doesn't mention a spinal anomaly in his report, you can have the radiologist perform an addendum to the report to coincide with your needs in providing your report and in providing your conclusions. So consult with the medical radiologist. Most medical radiologists that I've dealt with have been tremendous assets to me in helping me understand findings on imaging studies, particularly MRI studies, where they are looking at hundreds of MRIs per day, and I may not be. And so I rely on them to help me understand the findings and also to produce reports that support my conclusions. So that's secret number 8. Don't be afraid to consult with the radiologist. And you have an opportunity to indicate that you did consult with the radiologist on the QME Summary Findings form. On the QME Summary Findings form, it asks on page 2, and I believe it's question number 24 or question number 25, it asks you, did you consult with any other physicians in the formulation of your conclusions on report? And in this instance, you can check that box yes to indicate that you did indeed consult with other physicians. In this case, it would be the medical radiologist, and the conclusions of that consultation with the physician support your opinions and formulations of your final report.